Again, a very warm welcome to all of you. And we are having this third webinar from the series of webinars that we are having this year under the aegis of JISHA and supported by ISHA. And today we are very honored to welcome Dr. Pallavi Kelkar, who will be talking to us about writing of the research proposal, how it is an art as well as a science. I think she's one of the best speakers for these topics because she has a rich clinical and research experience spanning 16 years. And she's the associate professor, academic coordinator, and PhD guide at the School of Audiology and Speech Language Pathology, Bharati Vidyapeeth, Pune. She's also an international representative of India from the International Cluttering Association. Her areas of expertise, of course, is stuttering, cluttering, and professional voice. She is an international affiliate of the American Speech and Hearing Association as well. She has served as, she is currently serving as the secretary of MISHA, which is the Maharashtra branch of Indian Speech and Hearing Association, and she is the associate editor of JISHA as well. She has many awards and honors to her credit. She is the recipient of the NIDCD travel grant from the University of Maryland, USA. She is also the recipient of the ICMR International Travel Grant in 2018. She is the recipient of Manohar Memorial Award for Best Poster at ISHACon in 2022 and has 28 publications, 7 national and 21 international publications to her credit. 2 research projects have been completed under her, and she's a reviewer for many national and international journals. So I think she is an apt speaker for this topic, and we are all eagerly waiting for your webinar. Dr. Pallavi, all over to you.
Thank you so much, ma'am. I think it is indeed an honor to be introduced by one of your teachers who you have always admired so much. So thank you so much for that introduction. Before I start, let me give you all a heads up that today's talk is going to involve a lot of two-way communication because it doesn't make sense to just talk theory when it comes to research proposal writing. Right, so I will be asking you a lot of things along the way, pretty much throughout the webinar. And I would really like you to type whatever you think is the answer in the chat box. Please don't think about whether it's the right or the wrong answer. There are no right or wrong answers as such, which I'm going to come to soon. That it's all a matter of perspective. So just keep your minds alert and your fingers ready to type in the chat boxes. So as you can see on the first slide itself, this slide talks about research proposal writing being an art as much as it's a science. And any art is always something that has multiple perspectives, multiple interpretations, right? So I would like to start with the disclaimer that nothing that I will be saying today is etched in stone, all right? That this is the only way to do it and there is no other way to do it. Because, of course, there are so many researchers in this webinar itself, I'm sure, who will have slightly differing points of view or slightly different ways to approach the same thing, and that is fine. What I'm going to be trying to do is draw out a skeleton, if I may, or a broad template or broad brush strokes for you to fill in the fine lines as per your choice. All right. But before we do that, it is extremely important to first try to change our perspective of research and our perspective of researchers. Right? So, most of us, the generic perception of a researcher is somebody who is like this in this picture, right? Somebody who's wearing thick glasses, who is into books, who is always reading the fine print, right? Well, in my head, this is how I picture a researcher. According to me, a researcher is no less than an artist because he or she imagines something brilliant and finds multiple ways to approach it and then interprets the results in so many different ways. So, how different is that from an artist, right? So this perspective needs to change first in our minds. And to change that perspective, I think what we need to do is to switch hats with a reviewer, right? Try to get into the head of a reviewer or someone who reviews our research. And that is what I'm going to be trying to do today throughout the webinar. Before that, let us see how most of us would think, right? How a typical researcher, or especially novice researchers, might think. So, suppose a researcher is approaching a topic, especially a new researcher. How would they go about it? Firstly, they will look at what population do I want to study, right? So, do I want to study children or adolescents or adults? Do I want to study any specific groups, right? Like teachers or factory workers or university students. Now, within those, do I want to study somebody who is typical or somebody who is atypical? Once I decide that, now suppose I decide that I want to study the atypical population, then what disorder do I want to study? These are typically the first few questions that a researcher would start thinking about. Following that, once you decide that, then you start thinking, what parameters do I want to study? Right? Am I looking at subjective parameters like maybe a voice handicap index response? Or am I looking at objective responses like maybe responses to or voice parameters on MDVP, like the frequency or the intensity of the voice? Excuse me for giving all examples from voice and fluency. That's what's going to happen today because that's my core area of interest. Um, Next, quantitative or qualitative. So, am I going to look at something which is numbers, right? Am I going to look at totals or scores? Or am I going to look at people's responses? What exactly do they think in their own words? Are my parameters going to be something which is continuous data, right? Which can be expressed as decimal points, or categorical data, which is something which can be grouped like males or females? Once I decide my parameters, then I'll go on to think, how do I want to study these parameters? Am I going to look at, take my data online, or am I going to go meet every person, collect it offline? Am I going to use the hybrid mode? Is my study type going to be a survey, or is it going to be a quasi experiment, right? Like, are my people already classified into groups because of some traits that they have? For example, premenopausal and postmenopausal women, that's going to be a quasi experiment. Or am I going to do an experiment where I'm going to introduce my independent variable, right? How do I want to study it? Is it going to be studied at one time point, or am I going to study it multiple time points, right? Like maybe pre and then mid and then post therapy. Am I going to compare? Am I going to correlate? Or am I going to just explore and look at what are the means and medians and, interquartile ranges? Now, if you notice, the size of these headings is getting smaller and smaller. So, as a researcher usually thinks, this is the order of importance also that we give to these questions. And finally, what will be the likely outcomes of this and how will these outcomes help? So, this is usually now, if we look at it, it's actually like the PICO model, right? Population intervention comparison outcome. This is what we read in journals. This is how we think. Now let's try to switch hats and think about what the reviewer wants to know. Okay. So, in my experience, when I review a project or a paper or a proposal, the first question that I would ask is this study important enough? And if it is, then who is it important for? Who will it help? Either it should help researchers to carry forward their research in some way, or it should help academicians to maybe promote something academically. Maybe it should help therapists with a new technique or patients. Or maybe it should be something related to awareness that helps the general public. Who is this study going to help? That is the question that the reviewer wants to ask first and most importantly. But if you remember, this was the last part of our research proposal plan. If you saw on the previous slide, that was the last thing that we asked ourselves. So, what is the solution then? The solution is to flip it over. So, just flip it over, flip the idea over in your head and work your way up. Think of the implications first. How is your study going to help someone, anyone? All right. So this is how we are going to work our way up. What are going to be the likely outcomes of whatever phenomenon I want to study, and how will those outcomes help me or help anyone? Next, once I decide that yes, this study is useful, then I go on to say, well, okay, now I know my phenomenon of interest is useful. How do I want to study it? Next, I go to what parameters I want to study. Next, I go to what population I want to study. And if you see, the population is the last question, because that is going to depend on, firstly, which population needs this study the most. Second, which population is feasible or practical for me to collect in the given timeline. And third, which population is willing to give me data. Correct? So this is how a researcher should think when they start wearing a reviewer's hat. Next, now from here on, we are going to ask all the different questions that a reviewer wants to know. Okay, so the first one we asked was, we found out that the reviewer wants to know why this study is important or to whom the study is important. Second question the reviewer is asking is, have the researchers built a strong case for this study? Well, they are stating that it's important, but have they really given strong enough reasons for why they want to conduct the study? So, building a strong case has to be in three terms. Okay, so first, in terms of the background or research gaps. And actually, we had a very nice webinar by Dr. Chanchal last month. And if you've missed that, I'm sure it's available on YouTube. Please go and watch it because she's covered all this in great detail about background and research gaps. What I'm going to do is look at how you're going to write this out. Okay, so instead of just rattling on, I'm going to show you a paragraph. So here's a paragraph, and I want you to go through this paragraph. It's not going to take you more than 2 minutes. Go through this paragraph and let me know where you think it's lacking. Okay. Any mistakes or anything that's missed out, anything you feel that you would like to improve in this write up. This is a write up about background, research background for a study. Okay, so please go through it, and I would really want answers in the chat box now. So please right away think about whatever you think is lacking and write it out. I'm going to wait for you for 2 minutes to read this, and I'm going to wait for responses in the chat box. Ma'am, if you don't mind, can you just tell me if anything appears in the chat box?
Yes, I'll let you know. Sorry.
So I'm sure all of you have at some point written a research proposal or attempted to write one, and you must have got some feedback or corrections to it. So think about those. Think about where this paragraph needs improvement. And writing in the chat box is just going to make you a better researcher. So try to do it. If there are any students, don't hesitate to write.
I request everyone to be interactive, please. That will bring out the best in this webinar. Please feel free to write.
I just gave you a hint. I'll just give you the hint again. These three boxes that you can see, look at the boxes and try to figure out why those boxes are highlighted. What are they showing? When is this research conducted? Yes, I can see one response,
Yeah, one
three, four
response.
responses.
Pallavi, are you able to see the responses or do you
No,
want me
ma'am,
to read
no,
them out?
I'm not able to see.
You're not able to see?
I can just see the number of responses. I
Okay.
can't see.
So there is one person, Chandana, she says it's a years gap. It is years gap. There are strong gaps between these findings, is the second person saying. And latest research review should be included is another one by Shri Vidya.
Absolutely. So if you see, these years are dated. Absolutely right. Any other, this is just one hint I give you. You can find any more mistakes that you feel. And please type away. Any other
There is
points?
one
Other?
more response which says the format of citation needs to be changed.
Oh, yes, absolutely right. Bang on. Anyone else? There are 4, 5 mistakes. So think more. All right. One more
So
response.
there is one more saying latest review of literature should be included, and in third citation it should be in the APA format.
Absolutely right. All right. So let me just unveil some more mistakes for you. So this is the first one that yes, they are dated. We are in 2025 and we need more recent references. Okay, now look at this sentence, okay? Largely clinic level descriptions and single patient case histories or small case series. What does this indicate? This indicates that the level of research that has been cited is very basic. If you remember the research pyramid, case studies are right at the bottom. So ideally, a research review or a background should cover something more than case series if available. And if not available, like in this case, perhaps on midvas, there is not many studies done beyond case series. But look what this person is claiming. They are saying that midvas comes across as an effective approach to stuttering intervention. So this background is overclaiming. If you
Mm.
have only very basic level, level 3 or level 4 studies to support your claims, you cannot confidently say that some approach is found to be effective. All right. So it should match with whatever study or literature you've cited. More recent literature, just see the second last line. Most recent literature has adapted midbus concepts internationally. Now, can you see any reference cited here? There isn't, whereas there should be. Now, if you're talking about recent literature, then where is it? What is it? Which year is it? Has to be mentioned. And lastly, as somebody rightly said, this is not APA 7. So the 7th edition has to follow just both et al. 2006. So you need to be well versed with all this to ensure that your background is well written. Now, coming to the next thing that the research reviewer wants to know. Again, we are still on the same thing. Have the researchers built a strong case for the study? Firstly, we saw building a strong case in terms of the background. Now we are saying in terms of something else. Now, this you already saw. In this, the last point is something I want to discuss. The first four I already talked about, that it should be exhaustive, it should cite quality research, etc., etc. But the last point, presupposition, is an essential tool. I'm sure you've heard this word presupposition when you talk about language development, right? So when a child presupposes, what do they do? They're basically they know in their mind that this is what the listener knows and I don't have to repeat it, or this is what the listener does not know and therefore I should give more information. So presupposition is a very important tool when you're writing the background, because you need to think who are your potential readers and what are they already aware of. For example, if your proposal is for an international grant, the people over there are not really familiar with your country, your culture, the states in your country, what are the systems followed. So you need to dwell a little more on those. Whereas if you're writing for a study in India, for a project in India, then you don't need to give too many details on that, right? Whereas you need to fill them in more on international literature and then Indian. So presupposition is something very important you need to have in your kitty. Right. So second, building a strong case in terms of your rationale for your method. So this is another very important point, which I will keep restating throughout today's webinar, that your sections, the sections of your research proposal should all interrelate. They should all tie up together. Okay. So in your method, for instance, suppose you have taken a certain age range. All right. So in this, for instance, there's a study saying parental awareness about cluttering in their children. And here I'm planning to take an age range of 7 to 11 years. So if I've taken that age range in my method, then my introduction should build a case for it and talk about why 7 to 11 is a good age to build up parental awareness. Next, rationale for my research design. Now suppose my research design involves looking at attitudes of listeners towards different types of self-disclosure about stuttering, which means I'm going to expose my listeners to different speakers self-disclosing in different ways, or maybe the same speaker self-disclosing about their stuttering in different ways. Now, if a person or a participant is already exposed to one condition, they are not going to be able to be exposed to the second. So can I have a repeated measures design in this? I can't. I have to have a cross-sectional one where I have three groups and each group is exposed to a different condition. Okay, so that has to be explained in your intro itself. And maybe cite previous studies and say that, this is what has been done. And the reason it's done is because once you expose a listener and change their attitude, you cannot expose the same listener to a different condition because their attitude is already evaluated. Third, rationale for the tools used. Again, an example of a study. Suppose I am using the test of childhood stuttering to evaluate my children aged 6 to 9 years. Now, I have a reason, right? Why am I choosing the test of childhood stuttering? Why am I not using SSI-4, which is used everywhere? That reason has to be clarified in my introduction itself. Talking about what are the benefits of TOCS over the usual SSI-4 for this population, for the child population. All right, so the rationale has to be built for your method in your background and introduction. Third, the reviewer is going to ask, have the researchers built a strong case for a study in terms of its implications? So, implications, by that I mean I should be accounting for whether my results come this way or that, right? I'm going to give you examples to make that clearer. And my implications should again be in line with my introduction, my objectives, and my method. So if I've said something in my first three subsections, my implication can't be something completely different from that. Let's see some examples. So here, the first example, my aim is to develop an informative booklet for caregivers of children with cleft lip and palate. Okay. And what is my implication written? The developed material will help effectively educate caregivers of children with cleft lip and palate and thus facilitate early detection and intervention for these children. Now let's look at this implication. First of all, before conducting the study, am I sure that it's going to be effective? I'm not. I don't know yet. And so I cannot use the word effectively educate. Second, is my study really looking at whether that material then led to early detection and intervention? No, it isn't. And so I cannot write that in my implication. So that is what I mean by the implication should be related to the other sections and they should account for whether I will get a significant difference or whether I won't. Now, here's another little task for you. And this is a table, okay? So on the left column, there's a study, and correspondingly on the right column, there is an implication. I want you to tell me if the implication is correct or wrong. Okay, so let's look at the first study, effectiveness of a module for educating parents about cluttering. That is my study title. And my implication is dissemination of the module will help increase parental knowledge about cluttering. I just want you to type in the chat box quickly if you think this implication is correct or wrong. Don't point out what is the mistake. Just say correct or wrong. What do you think? Yeah, I'm seeing responses.
Yeah, so we have one right and one wrong so
Okay,
far.
any more?
One more wrong.
All right, so far the majority is for wrong.
Hmm.
Okay, so the answer
One
is wrong.
more, one more correct. One more correct. I think we are getting
Equal, equal.
50-50, equal,
Yeah.
equal.
So the answer is wrong because here I've written that the dissemination will help increase parental knowledge about cluttering, whereas my study is to test its effectiveness. So if the knowledge increases, then yes, it will increase. But I don't know that yet. So I can't state that in my implication before I conduct my study, right? You're getting the hang of it. Now let's try the second one. Comparison of self-disclosure versus no self-disclosure about cluttering, about stuttering. Okay, so there is one person who says that I have stuttering and then he starts talking. Another speaker who says that he doesn't talk only about it, he just starts talking. So the implication is the study will help educate persons who stutter about the benefits of self-disclosure. Yes, what do you think? Right, wrong? Two responses only so far. Come on, more people attempt. If you don't attempt, you have to try to get it right. Yes, what do we have?
So we have wrong so far.
Okay, so I think people are thinking that it's going to be wrong because this is part of the webinar. Let's see. Yes, you're right, it is wrong. And the reason that it is wrong is the study will help educate persons who stutter about benefits of self-disclosure. Unless I conduct my study, I will not know if self-disclosure is beneficial or not, whether listener impressions are getting better or not. I don't know that. And so without that, I can't use the word benefits in my implications. The third one, comparing ease of training and immediate outcomes of vocal function exercises and modified vocal function exercises. So there are two types of exercises, okay, among teachers. And the implication is the study will help determine which of the two therapy techniques is beneficial for long-term vocal health of teachers. Now you know how to go about this, right? Read the fine print. Try and attempt, right or wrong.
So again, we have a mix of correct and wrong.
Okay,
It's
here it
more
was really the fine
towards
print.
correct.
More
Yes,
towards correct?
more
Okay.
towards
The
correct.
answer is wrong
It's wrong.
because the study will help determine which of the techniques is beneficial for long-term vocal health,
Long term.
whereas it is clearly written that you're looking at comparing
So
ease of
immediate.
training and immediate outcomes. So there you have to really read the fine print. Last one, investigating attitudes of adolescents towards a peer who stutters. Okay, and implications. If the results of the study reveal negative attitudes, the data will help establish a baseline for changing attitudes towards stuttering in future. Yes, what do you think about this one?
So there is correct, one correct, two correct, and we are getting more correct for
Yes,
this.
that's right. It is correct because, as I said before, it is clearly mentioning that if the study reveals negative attitudes, then the data will establish a baseline for changing. If the study reveals positive attitudes, why would you want to change them? Right? So think about all this and then write your implications. That's what I want to say here. All right, moving on. Good, I'm really happy that everybody is so participative. Going on to what the reviewer wants to know now, the reviewer is looking at objectives. So, are the objectives well written? Now, well written is a very vague term. So, what do I mean by that? Firstly, are the objectives realistic enough? Okay, now this is a picture which I'm going to put up later also, and it's especially pertinent to when a project is written for a grant. Okay, so you don't really have to just look at the budget or the sample for that. You have to look at the interaction. So the sample, how feasible it is important. Based on that, your personnel will be decided, how many people and the tasks allotted. Based on that, your time will be allotted, and based on that, your budget. Now, the objectives have to be written realistically, keeping in mind all these factors. That is what I mean. And second, are the objectives unbiased? For example, if a proposal is looking at efficacy of a treatment approach, right? The efficacy is not yet established. You can't add another objective saying we are going to look at its implication in regular clinical settings because if you don't know how efficacious it is, you can't really look into the second objective at all. It's going to just go off. So maybe that can be a part of another study or another project. Second, the third, are the objectives clear and unambiguous, and are they in line again with the need and the aim? Now, here again, we're going to look at some examples. So, the first example, to explore parental reactions of children who stutter across various age groups. This is the study. The question is how many? How many age groups and which ones? The objective is not mentioning that at all. The second example, to assess vocal difficulties experienced by primary, this is a set of objectives, okay, in this second example. First, to assess vocal difficulties experienced by primary school teachers, second, by secondary school teachers, and third, to compare the vocal difficulties experienced by primary and secondary. Now, you tell me, if I'm comparing, am I obviously not assessing? I am, right? So, actually, the first two objectives are going to be redundant. Secondly, using the word assess For something as subjective as vocal difficulties, I think a better word would be investigate. Now, see here, there's a matter of the reviewer's prerogative. Most reviewers would prefer this word investigate. Okay, but there's no hard and fast rule. You can use both. But the redundancy is something that definitely needs to be dealt with, and I think that the first two objectives can go. Now let's look at two more examples and let's see. Okay, so first, example 3, the need for the study. Okay, the need for the study says there is a need to disseminate information about the role of speech and swallowing therapy for patients with head and neck cancers among the general public. Now look at this objective. It is saying to develop an informative audiovisual material for caregivers of patients with head and neck cancers. Is the need talking about caregivers at all? It isn't. It's talking about the general public, whereas the objective is talking about caregivers. So, this is what I mean by the objective should be in line with the need and the aim of the study. And lastly, the fourth example, to investigate gender differences and attitudes towards persons who stutter. Now, this is simply an example of an objective which could be written better. Okay, so usually using the word gender differences is not very preferred. I could reword it as to compare attitudes of males and females towards persons who stutter. Or if if I'm looking at genders which are non-binary, then I'm going to word it as to compare attitudes towards persons who stutter across gender of listeners. Okay, so make sure that your objectives are worded in a scientifically sound way, in as much detail and clarity as possible, and they are in line with the other sections of the study. Now, coming to the most important part that the reviewer wants to know. First important part was implications, which I said right in the beginning. Next, the reviewer is going to really, really look in detail at your method. And so, follow this rule always that the method should not leave anything to interpretation. If someone is going to read your study, they should know word for word what and how and when you did something. Okay? So, the reviewer is going to ask, are the researchers clear enough about the execution of the study? So, the first aspect of that is your participants. What I would recommend is when you write your method, have 4 clear headings. So, you should have participants, then the material that you use, then the procedure that you follow, and then the statistical analysis. Okay, so first, when you're talking about the participants, your inclusion and exclusion criteria should be extremely well thought out because that is going to really, really take care of your confounding variables. And especially in behavioral research, unlike in medical research, we have to be alert to confounds because there are so many personal differences and variations that it's really impossible to draw strong conclusions without ensuring that the two groups that you're comparing are as equal as possible in every which way. Okay. Other than this, there are some very basic mistakes that also are seen in research proposals. Let's see this one. Okay, so first example, exclusion criterion unwilling to provide consent. A lot of students write this. When somebody is unwilling to provide consent, then they are only not willing to participate in your study. You're not excluding them. So don't write this as your exclusion criterion. Second example, inclusion criterion, no prior exposure to therapy. Okay, so instead of that, instead of writing no in the inclusion criterion, you move this to the exclusion criterion and you say under exclusion criteria, anybody who had any prior exposure to therapy was excluded. Okay, so just a way of writing inclusion and exclusion. Again, if you've included something under inclusion criteria, don't say people with 20/20 vision will be included and people with visual problems will be excluded. It is understood. So don't repeat the same things in a negative way in the other side. And while you're talking about inclusion and exclusion, always remember operational definitions. Now, I've quickly given 2 examples over here. One is from one of my own studies. So, when we wanted to study people who stutter, we had to really ensure that the participants were not acquainted with someone who stutters. The problem is there are so many different ways to define acquaintances. So, does an acquaintance mean a first degree relative or a second degree relative? Or a close friend or just a friend. or a colleague or a distant cousin. All these are acquaintances. So then we had to operationally define acquaintance for our study, saying that a first degree relative or somebody that who knows a person who stutter or meets the person who stutter at least 3 times a week. So this we defined for our study, and that is fine. And but you need to form and write these operational definitions, without which it's very easy to misinterpret who is included and who is excluded. Next, another example, chronic alcohol dependence. A lot of people write this as one of the exclusion criteria. First of all, who is going to be very truthful enough to admit that they're chronically alcohol dependent? Secondly, how often is chronic? So again, something that you need to define more realistically and very, very objectively before you exclude somebody. Next, the next section is material. So if your material is ready, if you're using something which is already made or a tool or a test that is already made, give the information about that in the introduction or in the method and justify its use. For example, if you're using, like I said in the previous example, the test of childhood stuttering. So I need to give a short paragraph about it in my method, and I need to mention why it is beneficial over other tests in my introduction. If your material is created, which you have just made specifically for your study, then you really need to state the details of how it was validated. Who were the validators? How experienced were they? What fields were they from? How did they validate it? How was the cutoff decided on, did you use CVI or did you use some other method for validation? Everything has to be stated in as much detail as possible. Right? The rule remains the same. Next section, procedure. Again, now in procedure, you need to imagine how you would actually go about data collection. So as it would occur in reality with your participants, that is how you need to write the procedure so you don't leave anything out. Firstly, individual or group data collection. So in my head, I know that I'm going to talk to each person individually, but has it come into on my paper? No, but it has to. I need to write that the data was collected one-on-one through in-person interviews or online through Google Meet or whatever it is. So next, as I said, online or offline, but not both. Ideally, if you use one method, stick to that method throughout the study. You cannot have online for some and offline for some, because then that won't be equivalent unless some study has already proven that online is equal to offline. So for a therapy particularly, if you have earlier proof that tele-rehab is equivalent to in-person for that particular approach, then you can use both. But otherwise, stick to one. The response, are you going to use a verbal response? Are they supposed to write something or tick mark something? Or are they supposed to gesture something? How is the response mode? Will the participant be completely aware of the study objectives or blinded? Now, this is especially important for attitude studies, where you see something called a phenomenon of good subject. Where, for instance, if you ask me to my face that I'm going to study attitudes, how are your attitudes towards people who stutter? Of course, my internal response is going to be to show you that my attitudes are amazing, very positive, right? So sometimes you need to first just tell the person that this is a study related to people who stutter. And after you get their data, give them the entire information, your objectives, and tell them that they still have the reserve, they still can reserve the right to withdraw, which is ethical. If I've randomized, for instance, if I've randomized my participants, right? So I've put some in one group and some in the other. How did I randomize them? Did I alternately assign them to each group? Did I use a random number table? Did I use any software to randomize? What did I do? If I have assessors, okay, so if I have a therapy study and if I have people assessing, so how many assessors did I use? Did I evaluate inter-rater reliability? Did I tell the assessors that they were assessing pre or mid therapy recordings, because that's going to introduce a bias? Okay, so all this needs to be spelled out. I'm not saying that all this needs to be taken care of. If it is not taken care of, that is fine. You can mention it in limitations, but it needs to be mentioned. If I've used therapists, like if it's a large scale study and if I've used multiple therapists or there are multiple researchers on the same project, then how were they trained to ensure that the therapy was dispensed in exactly the same way? And if I have follow-ups involved, if I have multiple contacts with the patients, then how were those follow-ups done? Were they done in person? Were they done online? Were they done telephonically? Now, as you read through this, you will realize that there are so many fine details which are all in our head, but which we just forget to put down. So please remember, just imagine how you do it with the participant, and it'll all come. Now, there's another assignment for you to fill in the chat box. Tell me what is missing. Okay. The aim is to develop a screening tool to evaluate babies at risk for language delay. This is one of my own published study, but I've deliberately made some changes to take out, and there's some missing information. So just try and find it. Just read through this material, okay? This is a material section of my method. An item pool of 110 items distributed across 4 age ranges was created after referring to various sources from the literature. They were given to 2 experienced SLPs and they were asked to select items that they would typically use for screening a baby for a language delay for that particular age range. And if they felt that the item was better suited for another age range, they were asked to comment accordingly. So, in this manner, 80 items were retained and they were distributed across 4 age ranges. Now, you read this paragraph and you tell me if there's anything missing or there should have been something more written in this material section of the method. Come on, give it a
So we
try.
have some, yes, so there are some responses, Pallavi. One person has asked whether objectives have not been given. But I guess this question was that about that objectives as well?
No, this is just about the material section. In this
Yeah.
section, do you think there's more information that a reviewer might need?
So there are a lot of responses coming, which is really very heartening to know. Let me start telling you. So the specific age ranges are not mentioned. What are
Okay.
the age ranges? What is the language and
Yes.
the place?
Yes, absolutely. Hmm.
And the specific age range, qualification, years of practice. What is the kind of item? These are the responses we have got
Great.
so far.
I think we are all starting to wear the reviewer's hat successfully now. Let's see.
So
Experienced
how are the
SLP.
how are the
Yes, ma'am.
110 items selected? Are there any domains for selection of items? Whether they are
Yes.
actual toys or whether what kind of item they are and so on and so forth.
Super, excellent. So, out of all these, I've pointed out a few mistakes because we have limited time today. One
Yeah.
very important thing which the reviewer will ask is experienced is how experienced. Okay, so were they experienced in a particular area, especially language development? How many years of experience did they have? Were they from academia or from clinical practice? And as you all said, the age ranges are not mentioned. The items, where are they sourced from? They've just said sources from literature, but where all? What sources? What kind of items? What domains of items? None of this is mentioned, which should be mentioned. Now, if you mentioned there were 2 experienced SLPs, obviously they couldn't have agreed on all the items selected. So, if they didn't agree, then how was the consensus reached? Did they discuss amongst themselves? Did they discuss with you? And lastly, and very importantly, you're calling them experts, but you have not asked for any additional pertinent comments. So, was there
Hmm.
scope for the experts to make any additional comments? And if yes, what were they? And were those comments incorporated in the final rule? All of this information is to be included in your material, right? So, that is an example of how detailed it should be. Coming to the statistical analysis, always specify it as per the objectives. That's always very useful. So, nothing gets missed out. If it's qualitative, have you used any software for your transcription, for your thematic analysis? There are so many free and paid softwares available. So mention that. If categorization of the data was done before analysis, for instance, in one of our studies, we got questions about stuttering and we classified those questions about, questions about nature of stuttering, questions about therapy for stuttering. Now, how was this classification done? Was it done independently by 2 people and then was a consensus reached? How was a consensus reached? All this has to come before you write, or before you categorize some data for analysis. So this is about the method, and overall the rule is that the method, like I said, should be in line with the introduction and the aim and objectives. That is a ground rule. For example, now I'm just giving you a line by line example, okay? What do I mean by method should be in line with the introduction? This is a background of a study. One of the sentences in the background is stereotypical attitudes towards persons who stutter tend to vary across cultures. So this is one point that is made. Second point that is made in the introduction is use of bipolar adjectival scales for exploring attitudes limits the respondents' responses to adjectives or qualifiers. Third point that is made in the introduction is open-ended interviews are beneficial. Fourth point that is made in the introduction is interviewing through video conferencing has an added benefit of reducing time and cost and has a wider outreach. So you see, as I'm reading through this background itself, the method has started forming in my head. I'm understanding that probably this study is looking at attitudes towards persons who stutter, not using bipolar scales, but using open-ended interviews and using an online form. Okay. Again, previous literature reports use of softwares for thematic analysis. So again, what software have I used that is also getting justified? And that brings us to the aim, which is to explore attitudes of people working in corporate settings towards a hypothetical colleague who stutters. Again, here the corporate settings part is missed out if you notice. That has to also come in the background somewhere. And the method says that it used a qualitative approach and data were collected through one-on-one interviews using Google Meet. This is what I mean by everything should be in line with each other or tied up with each other. And lastly, what the reviewer wants to know is how is the quality of writing? So very, very important, referencing style has to be uniform throughout and has to be adhering to the guidelines, which are very, very easy to obtain online. Formatting, numbering, this is something very basic, but it is often found to be in error. So some people will start using Roman numbers and then switch to Arabic. Some people will start using numbers and then switch to bullet points. So use a certain formatting and stick to that. Avoid use of first person. So refer to yourself also as the researchers. Avoid using generic terms like many articles were reviewed or slight change was seen. Okay, avoid using these terms. Why, especially while writing a review paper, you should never say many articles. State how many and state why they were chosen. And lastly, again, I'm repeating, but very important, the different sections should tie up together. The method section should be in line with the objectives. The intro should be justifying the method. The implications should tie up with the objectives and the method. That is the sign of a good and well-written proposal. And now, some few things before I wind up today's talk. This is not the main topic for today, but this is something which a lot of people might be interested in. So I'm just putting the headings and you can go and read up more if you like. Um, the nature of the grant, is it national or international? Is it major or minor? Because depending on that, the rules of the grant will be different. Some grants give give funding for a research officer, some don't. Some give funding for travel, some don't. So it depends on the nature of the grant. So read the fine print. The time of submission, always be alert to when is the next deadline. The researcher criteria, ensure that the primary investigator, the principal investigator is in line with whatever criteria they have stated. So if it is that the PI should have a doctoral degree or a certain amount of experience or a certain designation, or they should be affiliated to a hospital, or they should have a certain age, everything has to be adhered to. Otherwise, it's a waste. And finally, and most importantly, the budget. So that brings me to the budget, which is something that a lot of people feel that it's okay to expand it. The point is the budget should not be so much that the proposal will be rejected for funding. Okay, so for example, some people just put in too many research officers when they're not required. Too high a salary for the qualification of the research officer, asking for things that the place of research should have. For example, journal subscriptions, especially when it's a university setup. A huge travel budget for an online study. These are all examples where the reviewer will straight away give comments that this budget is not required. If there's a budget assigned to training, then the number of staff, the duration of training, everything should be justified in the method section. And Similarly, the budget should not be so little that the project gets stuck along the way. So, as you all know, there might be some recurring expenses which need to be accounted for, and that's why it's very important to imagine the timeline and imagine how you will go about things. And are there surplus funds to carry on until the next part of the budget gets approved? So, for instance, if it's a 2 year project, after the first year, you will be submitting a report to whoever is the funding agency. They will go through that report and revert to you if they feel that they need to send you the next part of the budget. Now, till that happens, you need to retain your research officer, and to do that, you need surplus funds. So you need to make the budget accordingly. And while forming the budget, like I said, always look at not just the budget design, but also the sample design, the time design, the personnel design, and the budget design, everything together. Because if one gets affected, the other three will automatically get affected. Right? For example, if my personnel is less, then I can't probably take as big a sample as I'm aiming for, or I might have to cut down on the time. I mean, if my personnel is less and my budget is less, I'll have to cut down on the time, so I'll have to cut down on my sample. Or everything has to be aligned with the budget. Whatever it is interdependent on each other. That is something that we need to remember while finalizing a proposal and a budget. These charts people must have seen before. So Gantt charts are used very often. There's also another kind of chart, which is the PERT chart. Both can be used, but usually PERT charts are used for bigger projects. Okay, so whenever there is contingencies or there might be a small change in the timeline, or one level or one stage of the project is dependent on the previous stage, that is when you use a PERT chart. And when you want to represent each task independently in a given timeline, you use a Gantt chart. Okay, so the positive of a Gantt chart is it clearly chalks out the timeline, but the negative is that it's not really going to represent dependencies, how one task is dependent on the other, okay, or contingencies. That's not going to be well covered. So go read up more about this to find out which is suitable for your study. Some names of grants within India. We have the ANRF, the DST, the ICMR. UGC gives grants for universities. There are some international grants as well in Germany, US, Japan, and there are private institutions that also fund research. So, just for your information, and now coming to the take home points. Okay, so first important take home point, look at the what, but more importantly, the why and the how of the study. Why is it important and how are you going to do it? Work your way up, like I said, from the implications upwards. Pay as much attention to detail as we saw in all of the examples that we saw today. Look at the feasibility of the study. Like I said, the sample design should tally with your personal design, should tally with your time design and budget design. Cohesiveness of all the different sections, all the sections should tie up together. Clarity in your objectives, in your method. And finally, scientific rigor, the small little bits about writing references, about formatting, about the entire way you have written your research paper. And if you really do that, and if you wear the reviewer's hat, then like how we say in language development, no, that comprehension comes before expression. If you continue to read other proposals, if you wear the reviewer's hat and look from a reviewer's perspective, then even writing research proposals will become easier and easier. And it can really be a pleasure and it can be a scientific work of art. Thank you very much. And if you have any questions, then they're most welcome, or you can write to me at these email IDs. Thank you.
Hello. I think you really did justice, Dr. Pallavi, to the topic, which really so clearly specified how research proposal writing can be an art as well as a science, with beautiful examples, which really made the point come across very clear rather than being just theoretical, which we just read the bullet points. Okay. So if there are any questions, please feel free to type them in the chat box. Although this was one webinar where we were continuously interactive, so if there are any more questions, please feel free to type. We have Dr. Pallavi now, or you can also write to her as she just stated some time before. Any other questions? I think you're getting a lot of comments about many thanks. Learned a lot today. Thanks a lot, Dr. Pallavi. Okay, can you please elaborate on research writing being an art? Is a question by Bharati Prabhu.
Yes, so like I said right from the beginning, it is an art because first of all, there are so many different ways of seeing it, right? When you look at a painting or an artwork, you don't have just one interpretation of it, right? There are so many different ways to interpret it. Just like that, when you write research, you have, for the same results, you have so many different interpretations which come in your discussion, and they should come in your discussion. Similarly, to study a particular phenomenon, there are so many ways of getting there. You can do it through a survey, you can do it through an experiment, you can do it depending on the time you have, the feasibility of your study, and what appeals to you as a researcher the most. Okay, so I think that is where the art part comes in. The art part also comes in why in the style of writing. So when I said throughout that everything should tie up together, that is the art part of it. The science part of it is just the theory part of, looking at the right studies or citing the right method or, the theory. But how they all come together is the art of it.
I think it was really a very, very nice seminar, a very good seminar, an informative one which I'm sure has made people think and will go a long way for many students as well. I really thank you, my heartfelt gratitude to you, Dr. Pallavi, for making it interesting as well as informative. I also want to thank our audience today who has been very, very interactive. Thanks a lot. This builds our confidence in putting forth such topics for webinars. I also want to thank ISHA for providing us this platform and the executive officer of ISHA for being available for all the paraphernalia that goes with arrangement of these webinars. Thank you very much, and we will soon be sharing with you the details for the next webinar. Until then, thank you so much for this. We can consider it the close of this webinar, Shweta.
Thank you, ma'am.